So by this we have completed all 6 presentations, and I congratulate all the speakers, 6 speakers, and with the very good presentation. And they also brought into new dimensions in the nutrition issue, and those dimensions we never, not much work was done, and they have initiated, and we have to go ahead further forward. And now we are in. We have another 10 minutes time, and just this session is open for discussion. You can raise your hand, and then
Yeah.
you can ask your queries, and just introduce yourself, say
Yes.
your name. And
Great. My name is Belia Sparling, and I'm a Mana Fellow, and I also work on homestead food production and depression in Bangladesh. And I guess I'm interested to know from the panel, since so much of this was about homestead food production, I feel like a lot of the jury isn't quite out anymore on HFP, increasing dietary diversity. So, and I understand very personally that many of us started these trials and more rigorous studies before those sort of conclusions had been put out there. So I guess I would like to hear from the panel, for those of you looking at links between dietary diversity and homestead gardens, what we can really learn and do with these results at this time.
Again? Hello, I'm Anjali. I've been a Imana Fellow. I have 3 questions. First, to the mental health related studies. Did you use a standardized and validated battery of questions for identifying depression? What was the treatment given to the control group after identifying the depression? As considering ethical issues, we cannot have them untreated. And my second question is to the last person who presented, that was there any gender difference in the food sources when they improved the dietary diversity? You found that after the...
Have a question? Yeah. Hi, my name is Sudha. So I'm really glad that Amy presented in this session, because I think it really brought out the fact that there have been nutrition transitions and traditional foods have been lost in many parts of the world. And so the follow-up to all the researchers from Tanzania is, who studied, who did interventions in Tanzania is, do you have any idea of what the traditional food systems were before these people all shifted to market foods? Because from, I think the last presentation, it sounded like they were growing foods for the market. And then were farmers also, along with this nutrition-sensitive agriculture, were they continuing to grow commercial foods for the market?
Okay, this is Alessandra Gallier. I work as a senior gender scientist at ILRI. I have 2 questions and 1 comment. The comment is thank you so much. The presentations were really interesting. Many of you, I think, were working in Tanzania, and I had a question about the sustainability of the intervention. I think you were talking about distributing some of the seed and looking at the impact of nutrition. And my experience in Tanzania is that, especially in the very poor communities, it's very hard for farmers to actually get access to seed. That's one of the things that we are facing, or access to whatever they need to raise, feed and forage for the livestock. So I was wondering, what's the next step really for these communities to actually get access to the seed that can then improve their nutrition? And then I have one question for Cetron. I'm not sure I pronounce your name well. Thank you so much. It was really interesting. And then maybe a controversial issue. I always hear that depression is a product of the rich countries. And the poor countries, they don't have food, but they're happy anyway. So I loved your presentation. Like, yeah, fantastic. Let's actually unpack this stereotype. So I was wondering about your thoughts about that.
I'd like to thank the panel. It was a great session. And I was really happy to hear the work that's being done on mental health. And I would hope that we would all come away from this session saying we need to be working with public health professionals that have experience with mental health. And so to be, now that we have agriculture and nutrition and health together, let's bring in mental health also as part of that, and have the professionals working with us hand in hand. So that was great to hear. My question was, in one of the slides that was looking at the response to mental health, it appeared that poor mental health increased at the very end. There's some fluctuation and it increased at the end. So I just wonder if you want to comment on that.
Okay. Good afternoon. I am Aduronke from Nigeria. I'm actually an agricultural economist, and I'm interested in nutrition and dietary diversification. But what do you mean? I am asking this question. I want Marianne to answer it. I don't know what you mean by mental farmers. Yeah, you talked about mental farmers. I don't really know what you mean by that. Thank you.
So there is a last one question. You have some last bench here.
Is it on? Hi, my name is Anjali and I'm from IFPRI. My question is for Holland. Firstly, thank you for your wonderful presentation. I'm curious to know whether in your model, did you also include controls such as marital status and pregnancy status, and also the number of childbirths? I'm curious to know this because we did a similar, not really similar, but a study in India to see which are the predictors for mental depression among both men and women. And among men, the marital status played a very important role. So, if you see women together, about 9% were depressed, but if you just see married women, so about 25% of them were depressed. So, and even pregnancy played a very important role in determining depression levels. So, it will be great if you can elaborate on that. Thanks.
Thank you. So let us clarify all. So please start with first one.
Yeah. Oh, me? Okay. So there were a couple of questions that were broadly addressed at the panel. I think the one that was directly addressed at our trial was whether there were gender differences in food sources. Unfortunately, we didn't measure men's dietary diversity, and so we don't have the data to address that question at this time. In terms of... Louder? Okay. Is this better? So I'm particularly interested in a question about what we can do with the results, kind of mixed results of different contexts. I think, in research, we often try to find a blueprint and an answer and one true effect size, but I think the more realistic answer is that there are multiple pathways and facilitating factors and barricades to having a successful intervention, and so it's important to kind of engage the community and find out the adoption patterns that would facilitate a better effect in that context. For instance, on the topic of access to seeds, I think most of the trials that we're looking at are kind of efficacy trials or even effectiveness trials, and so obviously, we're providing seeds in these trials, but as part of the efforts to scale up these interventions, it would be important to acknowledge every step of the market chain and engage with suppliers of food chains and kind of get that into a policy framework where stakeholders in the government are ensuring that there are no missing links in the pathway from seed to agricultural production. Thank you.
So I'll start with one question over here about the if there were standardized batteries of questions. So yes, there were 20 questions that we took. We saw that it was validated in Uganda specifically. So we just used those 20 questions. And also, we conducted cognitive interviews with the enumerators of the study, and actually found that they did understand the questions, so it wasn't a full validation by any means, but we at least know that the questions were answering, or that they were understanding what the questions were asking. And then the other question about why mental health or why depression increased at the end was that unfortunately there was a bad harvest season in Tanzania right before in January 2019, and we see that in our farming data. So we were able to see that that's why people were depressed, because there wasn't enough food from the harvest.
Just to add, our dream is to do a full-blown validation study in Singida, Tanzania. So I heard validation studies are one of the future grants that Imana might. So wink, wink, maybe we can do that. What was done to control group? These measures are not, as Holland has explained, it's not a clinical diagnosis of depression. So that's why we keep saying probable depression. There's no way to really say that this person is or is not. But delayed intervention group did get the full-blown intervention starting January 2019. So they do get all these things that we give to the other intervention group. For the, yes.
Do we refer them if they say they're
I think one of the
suicidal?
questions is about suicide. Did you do a referral?
Did you do?
No, we didn't, because when we reached out, or the institution that we work with in Tanzania didn't know what, well, sorry, not blaming them at all, but we didn't know what centers were available around them, so there was no way to refer, and yes, that's unfortunate.
Any farmer suicides and that?
My understanding is there's no, my understanding there is no like immediate suicidal case that came up in our surveys. We did have things in place for domestic violence and other stuff, but for the suicide, it's not something that we specifically look out for, but it's not something that came out in the conversations that we have on all these surveys. It's not something that came up that the enumerators bring up to us as something to be worried about. Should we answer you, or should we continue with the?
Yes, yes. Yeah, yes.
So can I just continue first? Okay, for the, something about legume seeds. Oh, the sustainability of the project. We gave these legume seeds in the first year, and with very clear,
You have to answer anything?
with very clear expectations that we are not going to give them again. So we did work with the farmers, and especially the mentor farmers, to really figure out ways to how to continue them. And actually, a lot of them do different, the different villages do different things to make sure that there are enough. Some do it more in the household level, some more do it more in the community and the group together. But there are also now a formal group that is registered with the government of Tanzania to make sure that this project continues. And this, the mentor farmers of our projects have been called to different things, to different events and different collaborations to really share the lessons they learn here. So I think there's a lot of excitement by the Singida District Council to really continue this work. And I meant mentor farmers, so mentor farmers, not mental farmers. So they really, the people who really work with us in this. And for the comment on the marital status and everything, that is an analysis that we really want to do. But for the impact estimates itself, we control for fixed effects of, so do we control for their own individual. But all of those are very interesting things. I'm really looking forward to see that. We did compare men's and women's depression on the same household, and there's a lot of interesting stuff. So let's talk after this too.
Yeah, do you have anything? Okay. Thank you. Thank you all the speakers for excellent presentation as well as your clarifications. And the take-home message is the sensitive agriculture farming is very essential, and nowadays farmers are more interested towards commercial crops, and those importance and even incentives, those who are producing healthy food and healthy crops, they should have given some incentives, and those kind of programs may be promoting the healthy food production. So thank you for giving this opportunity, and thank you for patient participation and active participation from the delegates. And thank you once again. And I have to appreciate myself managing the session in time. Thank you.